I'm Adrian Giles. I'm part of the management team at South Worcester Clinical Commissioning Group. It's a consortium of GP practices who look after the care of about 290,000 patients. I handle the organisational development for that group of practices and also look after specific clinical projects on behalf of the board and the GP clinical team. The project with Oberoi is around what we call an integrated care and treatment service for our patients who have orthopaedic problems, patients who have pain, who are suffering with musculoskeletal conditions. We found that in our group of GP practices, historically, we were spending a considerable amount more money on orthopaedic specialties compared to other populations, similar sized populations in the country. And we needed to take a look at why that was, why we were referring so many patients. And so we set up this service where GPs refer their patients in, and those referrals are triaged by specialist orthopaedic practitioners before that patient gets sent on to an orthopaedic consultant in a hospital. And we're finding at this stage that about a third of the referrals are wholly appropriate and need to go straight to see an orthopaedic consultant. About a third we're not too sure on, and we need to see those patients, and we see them in primary care. And the other third, we can probably direct them to another service within a primary care setting. The role that Oberoi have played is around the data and the audit. It is absolutely crucial to us as we measure the success of this project that the data is collected within 31 GP practices, and Oberoi's role is ensuring that our data is accurate and we capture it appropriately and in a timely fashion. The key learnings have been that if you are going to change a clinical pathway of this magnitude, you need to give it time. I think we tried to implement this change. We started it in October 2010, and we believed that it would be up and running and everyone would be referring to the new system almost overnight. And I think on reflection, that was a little bit naive. I think that it's taken a good 6 months for GPs to understand the new system, to complete the referral criteria that we've asked them to do. So the key learning for me is that if you're going to make a major clinical pathway change, you need to allow enough time and ensure that the communication to GPs is spot on, because change doesn't happen automatically or immediately. Oberoi have done a number of elements of this project at a quite a simplistic level. They helped design the original referral form. Bearing in mind we've got 31 practices in my GP group, there are 4 or 5 different clinical systems or variations on clinical systems. In order to get a standard referral form from all of those practices and have it on an IT platform, we needed some support, and that's what Oberoi started with on this project. The second element that they helped with was actually auditing the referrals that came from GP practices. And that's a feat in itself. I mean, I cannot underestimate, I'm talking about 8,000 odd referrals a year. And to actually extract those from a GP practice, 31 practices, where there could easily be 100,000 GPs in referrals in a year, is quite a daunting task. So Oberoi were able to go and set up the reports to enable us to extract that data and discern which practices were referring and where they were referring to. So it complemented all of the other work along this pathway. It gave us the evidence that we needed to make changes that needed to be made as we went on the journey of sorting out this system. I've known Kavita Oberoi for a number of years, and I've also known Joe Crossan as well. I've worked with them in various projects, and they've always delivered. It's as simple as that. I know that if I give them a piece of work, Oberoi will deliver on it. And the other important factor here is there are so many consultancies and companies offering various pieces of work to the NHS. Most of the time, they tell us what we already know and charge us an awful lot of money for it. That's not the case with Oberoi. They do what we ask. It's a price that we can afford, and the relationship works. One of the long-term benefits of this project that has been in orthopedic conditions is that we will replicate it, I believe, in other medical and surgical specialties. One of the pieces of work that has dropped out from specifically the Oberoi element of the project is it's been made clear to us that practices have not been consistently recording referral data in terms of their coding, and that is a byproduct of the audit that Oberoi Consulting helped us with. That means that we now know that with some training and some standardization of referral codes, we won't make the same mistake twice, and we will be able to accurately report referrals in other specialties going forward. So we're delighted.